Thank you to all our speakers for the second sessions. We are now ready for some questions, about 10, 15 minutes.
So the question was, can you use laser to treat the cataract? And in fact, you can. There's a laser out there that's relatively new, and it's designed to do certain parts of the cataract procedure, not the whole thing, but it can help the standard cataract procedure and make it easier in some cases to do parts of the cataract procedure. And so there are some advantages to using the laser. Currently, in most places, it's a premium, it's an upcharge to do that. It's sort of like getting leather seats and air conditioning on the standard base model of your car. The laser can actually create some of the incisions that historically were done with an incision through a blade or a knife. Yeah. And so there's some advantages in terms of precision and reproducibility and being able to predict what it's going to look like. But we haven't gotten to the point where the laser can do the whole thing all by itself.
How do we know when we are legally blind?
So it comes down to the definition in regards to what your optometrist would diagnose you as. Again, it's generally considered, and they can correct me if need to, but 2150 or 2200, which is your visual acuity, how far you see, or if your visual field, is less than 20 degrees. So in regards to VA care, if that's what the question was pointed towards, is if you have your doctor has a note that says that they're legally blind, that would designate that.
And it always is tested with your straight ahead vision and determined by your better vision eye.
Yes.
Once you have chronic dry eyes and use Restasis, are you stuck with that for life, or can you ever not have dry eyes?
So the question is, if you have chronic dry eye and you're taking Restasis, which is a prescription eye drop, are you stuck with it for life? And the answer is no. Glaucoma, for example, is a disease where once you start the drops, you can expect to be on them for the remainder of your life in order to keep the pressures under control. But dry eye, we've come to learn, is there's an inflammatory component to it. And once you can bring that inflammation under control and help stabilize the surface, the moisture on the surface of the eye, and that's what Restasis helps to do. There are some patients who can take Restasis for a while, and then as their eyes improve, they can try not taking Restasis, and if they do fine, then they don't need to continue.
Are there any tests or any studies that we can volunteer for to help further generations in macular degeneration?
So we've talked about this briefly, I think, during the first session, and we have quite a few studies through the clinical trials unit here at the University of Wisconsin. Right behind you, we have our clinical trials unit team, and they're helping us with the microphone so they can answer some questions about trials and, what stuff we have going on. But that's a great question.
I wondered about alternative treatments of acupuncture and ozone therapy, possibly for macular degeneration.
This is another great question, and it doesn't seem right now that we have a lot of research on alternative treatments, homeotherapy, homeopathic medicine. We know definitely the, decreasing the oxidative stress, taking the vitamins, a healthy lifestyle tends to help with progression. And once really there's advanced macular degeneration in the form of wet AMD, we have injections. But a lot of these new strategies or treatment methods we are just investigating.
If one has a larger than normal cup to disc ratio, but normal eye pressure, are you at greater risk for getting glaucoma?
So the question was, if you have a large cup to disc ratio, but normal eye pressures, are you at greater risk for developing glaucoma? And the answer is maybe. So glaucoma, we typically think of it as a puzzle. Generally speaking, there are 3 or 4 parts that we look at in terms of if a patient has high eye pressure and the cup to disc ratio, which is basically a cup to disc ratio is what the optic nerve looks like when the ophthalmologist looks into the eye at the back of the optic nerve. So if the cup to disc ratio is enlarged and the pressures are high and you have a visual field change, the testing, a screening test that they do, well, that's a slam dunk. You've got glaucoma, you should be treated for that. But if you only have one of those problems, maybe the pressure is high, but everything else is normal, or the cup to disc ratio is unusually large, but the pressures and the visual field are normal, then you are generally put into you become a suspect. You're a glaucoma suspect. And in that situation, it would be important just to get regular exams periodically just to make sure that that situation doesn't change.
Hi, I have a question. Okay. I have a question for the VA benefits. Okay, so if you are a spouse of a veteran and you're receiving veteran spousal benefits, are you open to receive the low vision benefits?
That's a good question. I'm not sure if you are allowed to receive that. So the answer to that is if you receive, you receive the CHAMP VA. Oh, okay. So there's something called CHAMP VA, and that's for spouses of veterans. The easiest thing to do is actually to go online, to go to champva.gov, and that really highlights all the different things that someone may be eligible for in regards to receiving the various benefits. Sure, yes, absolutely. Did you get my number? Okay. Okay, it's 11960. 11960. Yep.
We have time for one more question if anyone has any low questions or concerns.
Over here.
Yes.
How is the low vision clinic on the basement level of the University Station Clinic compared to the new one that will be located on the 2nd floor?
So the clinic that used to be at the basement level was just with a low vision therapist. This one will have an optometrist. So we'll be doing the evaluations and the training together.
Okay, thank you.
Maybe time for one more question. Yes.
This is not the dry eye itch, but the lid itches. You know, one eye now and the other eye. Then an hour or 2 or 3 later, or the next day.
So the question was, if I can paraphrase you, why are my eyelids itching? And it could be one eyelid, it could be randomly occurring at different times in the day. Most of the time, this is because of a condition called blepharitis. And you can think of it like dandruff on the eyelashes. It's something that it's very difficult to get rid of. It can flare up, it can quiet down. And there are some things that we can do to treat it when it tends to flare up. But it just gives you the same kinds of symptoms that you've described. It can be itchy, it can be grainy, it can be red, the eyelids, and but it's very, very common. And it kind of flares up and quiets down of its own accord, but there are some things we can do to quiet it down. It's generally not more of a nuisance than anything serious. It's rarely anything ever serious.
Thank you everyone for the questions, and thanks for the excellent speakers for the second session.